Hello, welcome to Telesur. I'm Carla Gonzalez and this is from the South. Colombia's leftist senator and former presidential candidate Gustavo Petro has announced that he has cancer, having learned of the illness after traveling to Cuba for medical examinations.
I decided to go to Cuba to do some complete health exams. There, on March 2nd, I was diagnosed with an illness, early cancer in the joint between the esophagus and the stomach. I returned to Colombia to have a second medical opinion, and after laboratory analysis and endoscopies, the existence of a lesion in the same area, I decided to return to Cuba on the 18th of March to have a look at all of the studies and medical opinions, and to make my own determinations. On Monday, April 13, at 9 a.m., I will have a new endoscopy, this time with surgical intervention, in order to try to completely remove the damaged tissue. If it cannot be removed due to the delicate state of the tissue, and if the existence of the cancer is confirmed, I'll enter into chemotherapy and radiotherapy treatment. Due to the existence of the virus, I will be in total confinement.
The Organization of Petroleum Exporting Countries, together with allied nations, reached an agreement to reduce oil production by 23% in an initial period of 2 months. The move comes as the 9th OPEC Ministerial Conference saw countries propose curbs to boost sinking crude prices. This happened during a virtual meeting on Thursday. Russia, Saudi Arabia, and allied producers have agreed to cut a combined 10 million barrels per day. And Mexico's president, who initially was reluctant to cut crude production, said the nation resisted because it took significant steps to raise its output capacity.
The United States is committed to reduce, additionally to what it was going to deliver, 250,000 barrels as compensation for Mexico, according to President Trump. We resisted until the end because it cost us a lot of effort to raise production.
Guyana's Elections Commission has agreed to a recount of ballots from the March 2nd general elections.
Continued on the position that we are going to do a recount. I think we've agreed that the venue which the recount should be done should be the convention center, but of course that is subject to permission being granted to use the center. I would hardly like to think the permission would not be granted. We agreed on the
Brazil's Hutucara Yanomami Association have expressed concerns about the lives of their people following the death of a 15-year-old Yanomami indigenous boy after contracting the coronavirus. Indigenous people in the Amazon rainforest are particularly vulnerable to foreign diseases.
Today, we, the Yanomami, are very sad. For the first time, a young Yanomami died from COVID-19. Therefore, we are very worried. This disease is getting closer to here in the state of Roraima, and this disease will get into our Yanomami territory. The disease is increasingly growing in other states in Brazil, and our relatives are also being infected by this disease, COVID-19. This is very dangerous for us. That is why the Hutucara Yanomami Association is concerned that this COVID-19 is very close to this indigenous land.
The World Health Organization says it is concerned about the high number of health workers getting infected with COVID-19.
We are particularly concerned by the large number of infections reported among health workers. In some countries, there are reports of up to 10% of health workers being infected. This is an alarming trend. When health workers are at risk, we are all at risk.
The WHO also warned that premature lifting of restrictions to stop the spread of the pandemic could lead to a resurgence of the disease.
WHO wants to see restrictions lifted as much as anyone. At the same time, lifting restrictions too quickly could lead to a deadly resurgence. The way down can be as dangerous as the way up if not managed properly. WHO is working with affected countries on strategies for gradually and safely easing restrictions.
In Mexico, concerns are being raised about violence against women during the quarantine, and stay-at-home orders can be a risk for women who live with their aggressors.
A national network of shelters helps women who have been victims of violence in Mexico.
I was physically and sexually abused, even economically. All sorts of violence from my partner.
He would beat me up at night when my daughters were asleep. The next day, they would see the marks on my face.
In the times of the global pandemic, this situation worsens for those who live with their aggressors.
40% of femicides take place in the victim's own home. This shows that many women's homes are the most dangerous place for them. 80% of the women we give shelter to were victims of violence in their own homes.
While staying at home is the most effective way to stop the spread of COVID-19, health authorities, since social distancing measures started to be enforced on March 23rd, distress calls to the shelters have increased by 60% and requests to be sheltered by 30%.
You must also consider that many cannot stay at home every day because they have no stable source of income. This in turn aggravates violent situations, often affecting women and children.
For its part, the government has launched a support system through the 911 emergency phone number.
While isolation can generate stress or conflict within families, this can never justify violence.
The National Women Institute has made a call on families to use the time under quarantine to question gender roles and to more equally distribute domestic tasks.
We're taking a short break now. Join us again in just a minute. Welcome back. Let's continue with news. The Prime Minister of St. Vincent and the Grenadines, Ralph Gonsalves, has asked that this Easter be celebrated with some distancing, bearing in mind the threat of the COVID-19.
But this weekend, Good Friday to Easter Monday inclusive, which usually is a period for spiritual reflection and jollification, well, let us try and do both of them in a manner which is consistent with the physical distancing at the time of COVID. Let good sense prevail, good balance, and we leave the rest to Almighty God.
And this Good Friday, St. Vincent and the Grenadines received 3,000 rapid test kits for COVID-19 from Venezuela. Prime Minister Gonsalves and the Minister of Health, Wellness and the Environment, Luke Brown, received the kits at the Argyle International Airport. Venezuela is sharing supplies with the Caribbean neighbor, having also received medical supply donations from China, Russia and the United Nations. Trinidad and Tobago has advised Venezuelan nationals seeking residency or those legally required to return to their homeland that the expiration of their one-year work permit will be deferred during this stay-at-home period due to the novel coronavirus.
Persons whose permits or the persons who have applications in for residency, you're granted a certain amount of time, then you must come back and do the interviews. We said a couple of weeks ago that all of those interviews have been rescheduled, so there is no risk of persons who expire during this period of anything untoward happening to them. So immigration, we've taken the decision that all of these extensions will be dealt with after the stay-at-home period. Persons don't have any risk. They're not taking the appointments right now.
The Prime Minister of St. Lucia is appealing to creditors to give people relief as the country battles COVID-19 and as it prepares for hurricane season.
I firmly believe that tourism will remain a big part of our economic fortunes in the future. I'm appealing to all creditors to demonstrate compassion by providing relief to persons indebted to you. This includes landlords, hire purchasers, companies, and others. Unfortunately, we're currently faced with a drought amidst the destabilizing effects of COVID-19. In addition, the 2020 hurricane season is also not too far away. This all makes the situation and challenges somewhat daunting. But with our collective efforts, we can and we shall overcome these threats.
And St. Lucia has confirmed one new positive COVID-19 case today.
There are now 454,710 confirmed cases in the region of the Americas. On Friday, April 10, 2020, St. Lucia confirmed one additional case of COVID-19, bringing our national total to 15. A total of 24 samples were tested, with 1 positive and 23 negatives.
The government of St. Kitts and Nevis has extended the state of emergency to combat the pandemic to April 18th. A 24-hour lockdown will be implemented on Thursday from 7 p.m. to 6 a.m. on April 16th. As of Thursday, 11 people tested positive for the novel coronavirus. St. Kitts initially implemented a 24-hour limitation on movement that was expected to end on April 3rd. The Prime Minister of Belize, Dean Barrow, has said that Cuba is perhaps the world leader in international solidarity. There are currently 58 Cuban medical professionals working in Belize.
The assistance Cuba began offering to the world started just about the same time as the absolutely cruel and inhumane blockade was put on Cuba by the United States of America. So that the self-sacrifice of you and of the people and government of Cuba has now become a matter of legend. And it is fair to say that Cuba is perhaps the world leader in the area of international solidarity.
In Cuba, free medical health care for all citizens has been one of the pillars of the revolution. Let's have a look at how this system is handling the COVID-19 pandemic.
In these days, marked by the novel coronavirus, these images are exclusive to Cuba.
Good morning. We are medical students and we are doing a survey on the health of the population to see if they have symptoms.
Over 25,000 medical students visit Cuban homes to detect and prevent new cases of the pandemic.
People are grateful, not just because they are being cared for, but because they are being reassured that things are under control.
The ongoing search for possible infections is part of the island's healthcare system.
Have you had any respiratory symptom? Anyone from your household?
It has over 100,000 doctors as well as 9 specialists for every 1,000 residents. Since 1984, the development of a family care program has been an essential part of the system as well, providing one doctor to every community.
This framework is Cuba's greatest strength, something that was developed over many years and that has been improved over time with better training and resources. This allows thousands of med school students to make home visits.
Despite foreign pressure and shortages caused by the decades-old U.S. blockade, the island has guaranteed free health care to the entire population, while also helping other nations across the globe.
Over 50 years we have been providing help. Since 1963, over 450,000 health professionals across various generations have saved over 7 million lives.
Biotechnology is one of the best developed fields in Cuba, with close to 20,000 workers moving forward with many advancements, including the interferon alpha-2b, which has proven to be essential in the global fight against the novel coronavirus.
The Cuban interferon has been worked on for over 30 years. There is a lot of experience working with it for other illnesses. We know it helps patients build an immunity, and we believe it will continue to be essential to fight the coronavirus.
Doctors, not bombs. That is the message Cuba has long defended, and that has led to over 600 Cuban doctors to be deployed to more than 14 countries affected by the pandemic.
We are an army of white ones, willing to share our knowledge and save lives anywhere in the world.
Amidst a smear campaign aimed at the Iceland humanitarian program and a global pandemic that has put on display the fragility of developed nations' health system, Cuba is strengthening its system with solidarity and a guarantee of life over money.
Authorities in the city of New York have begun burying coronavirus victims in mass graves as the death toll continues to rise. Aerial footage posted on social media shows workers wearing hazmat suits or other personal protective equipment while digging graves and stacking wooden coffins in deep trenches on the city's Hart Island. With more than 160,000 confirmed COVID-19 cases, New York State now has more cases than any country in the world. More stories coming up. Don't go away. We'll be right back. Thank you for joining us again. Authorities in Yemen have announced the country's first confirmed COVID-19 case, raising fears that an outbreak could overwhelm the already crippled health system. A Ministry of Health official told journalists that the case was recorded in the southeastern province of Hadramaut. He added that the 73-year-old patient is receiving treatment and in a stable condition. The 6-year civil war between Houthi fighters and a Saudi Arabia-backed coalition has destroyed more than half of the country's health and water facilities, leaving the country vulnerable to disease outbreaks.
The first confirmed case of coronavirus was recorded in our country, on the coast of the Hadramaut province. A Yemeni citizen in his 60s. He is now receiving healthcare in one of the quarantine centers in the Hadramaut province.
United Kingdom Health Secretary Matt Hancock says that the country has recorded 980 deaths from coronavirus in the last 24 hours, the highest daily death toll since the pandemic broke out.
The number of people currently in hospital with coronavirus symptoms is 19,304. Of those who've contracted the virus, 8,958 have sadly died, an increase of 980 since yesterday.
And Italy is seeing a reduction in the number of people in intensive care. Civil Protection Special Commissioner for the Coronavirus, Angelo Borelli, told the nation on Friday that the number of patients in intensive care decreased by 88 units. Health officials say over 140,000 people have been infected and local hospitals are struggling to cope. Additionally, 610 people died between Wednesday and Thursday, bringing the country's death toll to over 18,000. And another affected country, Spain, has reported its lowest daily tally of coronavirus deaths since March 23rd.
In the last 24 hours, we have recorded 4,576 new coronavirus cases, which gives a total of 157,022 infections. Based on these figures, the increase in the number of cases today is 3%. This means we're continuing the downward trend we have observed. The increase in the number of cases in the hospital and intensive care units is also 3%. Today, as it was in the case of the previous days. And regarding the total number of deaths, that figure stands at 15,843, with 605 fatalities in one day. Additionally, 55,000 people have recovered and left the hospital.
Botswana's parliament on Thursday approved a request by President Mokgweetsi Masisi for a 6-month state of emergency to allow the country to respond to the pandemic. The request was approved after a debate during which opposition members rejected the proposal. However, ruling party legislators used their numerical advantage to pass it. The country has recorded 2 COVID-19 cases in the last 48 hours, bringing the total number of confirmed cases to 12, with 1 death. The South African Communist Party has called for the United States to lift the unilateral coercive measures it has imposed on Cuba, Venezuela, and Iran, especially now during the pandemic.
Sanctions against countries as we are currently facing the COVID-19 pandemic. We call for the end to the criminal embargo against Cuba. We call for the United States not to impose any further sanction and instead to lift sanctions against Venezuela. And we also call upon the United States and other countries to lift sanctions against countries like Iran. This is no time for sanctions, but these are times to actually unite and for humanity to together fight against the current challenges that we are facing.
A partial curfew and the closure of businesses are some of the prevention measures taken by the Syrian government to limit the spread of COVID-19. To mitigate the effect this could have on people, authorities have also guaranteed the availability of basic goods at accessible prices.
Bread is the first item in the list of goods that must be made available by the Syrian government. The over 1,000 public bakeries across Syria did not stop functioning despite the curfew ordered 2 weeks ago. Establishments that, despite the pandemic and the criminal blockade imposed by Western powers, continue to produce a vital product at a subsidized price.
We start work early in the morning and go on all day until we reach our production quota. As such, we are able to fulfill public demand and guarantee the well-being of our people.
Despite the over 9 years of war, national food banks have amassed enough basic goods at moderate prices. These sites were also excluded from the curfew, as long as they adhere to the required public health measures.
There is no panic among the citizenship. As you can see, the government has guaranteed access to all basic necessities at good prices, despite the pandemic and the economic sanctions.
We are suffering under unjust sanctions imposed by the United States. We demand that during this pandemic, they lift the economic blockade against Syria and against Iran and Venezuela as well. We are fighting against the same enemy that is attacking Venezuela.
Syrians are not in need of hoarding goods in their homes. From 6 a.m. until 6 p.m., 7 days a week, they can visit these establishments. Economic losses caused by the war and Western unilateral measures amount to $500 billion. But despite this, the government has not made cuts to its social subsidies programs.
A campaign by Alba Movements and the International People's Assembly is calling for the end of sanctions to save lives amid the COVID-19 pandemic. Claudia de la Cruz of the People's Forum says the Trump administration has shown disregard for human life.
As many of you know, the U.S. ruling class is taking advantage of this moment of crisis to boost its war against the working class at home and abroad. The Trump administration has taken this moment in particular to weaponize the virus that is attacking so many of our communities, particularly the poor and working class, and allowing many of those communities to die. In the US, the incompetence and negligence of the government in response to the virus pandemic has resulted in the infection of more than 300,000 people and the death of over 10,000 people. The US government's blatant disregard for human life is both immoral and criminal. In just a few days, the US government has seized ventilators going to Barbados that are key to islands' capacity to save lives in response to this crisis. It has ordered the largest deployment of US military in our continent in the last 30 years, with its vicious fixation on Venezuela. It is important to remember that the latest attacks are just part of a string of aggression against the Bolivarian Revolution in an effort to crush it and also reaffirm US dominance in the continent. So we have to see the geopolitics that play into this, these actions that are being taken at this particular moment in time.
And with that, we end our news brief. But you can find these and many other stories by checking our website, telesurenglish.net. And if you can, stay at home. We'll keep you updated. For Telesur English, I'm Carla Gonzalez. Until next time, and stay safe.